So this Insta lecture would be the role of immunohistochemistry in the cancer diagnosis. Now, cancer diagnosis has changed a lot in the last 20 or 30 years, and one of the major changes which has been brought about is by this game-changing technique of immunohistochemistry. And immunohistochemistry is basically made with three words, if you look at it: immuno plus histo plus chemistry. Normal stains which we used in the histology or histopathology, basically they contain a lot of dyes to identify some portion or substance, cytoplasm nucleus in the cell. But in immunohistochemistry, basically we use immunological principles, antigen antibody complexes, to particularly identify an antigen, a specific biomarker in the cancer cells, using some chemistry principles also, like chromosome, using to color that, particularly color that antigen antibody complex or antigen. So the word immuno is there because we are using immunological principle, as well as you are using some basic chemical principles. That way, at the end there is chemistry, and we are using this on a histological, means a tissue section on a biopsy, to identify a particular marker of a cancer, which is expressed inside the cell, cancer cell. It could be expressed over the surface of the cancer cell, it could be inside the cancer cell, that particular antigen, that protein which is expressed. So in immunohistochemistry, in a nutshell, we are particularly identifying a specific protein or antigen which is expressed over a cancer cell or inside a cancer cell, to identify, to characterize, to subtype that type of cancer. That is the basic principle of this immunohistochemistry that you need to understand. Now, immunohistochemistry, why we use immunohistochemistry? If you look at the diagnosis of cancer, the lab diagnosis of cancer, there are basically it could be divided into two groups. I'm just going through some basics. One is called morphologic methods, another is called the molecular methods. Morphologic methods basically contain, which we use to identify the morphology, the appearance of a cancer or the cancer cell or cancerous tissue. They are usually used the normal biopsy histopathology. Biopsies could be an FNAC smear, fine needle aspiration cytology smear. It could be a bone marrow biopsy, it could be a bone marrow aspiration, it could be an exfoliative cytology like a pap smear, which is used for early detection of the cervical cancer. So all these are actually the morphologic methods, and to pinpoint, to precise the exact diagnosis of the morphologic diagnosis, we can use the immunohistochemistry. Now, immunohistochemistry, the next thing which I like to tell you, which is most important to know actually, that what is the exact purpose of using immunohistochemistry, how it exactly helps us. It basically helps us in three ways. Particularly, it helps us in exact characterization of a cancer or malignant tumor. Like, for example, an anaplastic carcinoma or a lymphoma or a sarcoma, or may look sometimes similar on the biopsy. You cannot just look at a normal stain biopsy, hematoxin eosin stain biopsy, and make a diagnosis, because many of these cancers, which are different subtypes of cancer, they might look similar on a normal biopsy. But you need to specify the diagnosis, you need to pinpoint the diagnosis, and that is only possible when you can use a specific technique to pinpoint the diagnosis by using the immunohistochemistry in this sense. Immunohistochemistry can exactly tell you that this is anaplastic carcinoma, this is not lymphoma, and that is lymphoma, not anaplastic carcinoma, just by detecting some specific markers, some proteins, some antigens which are expressed by the cancer cells. This is the basic idea. For example, usually the cancer cells, if they are carcinoma, that means the cancer cells which are originating from epithelium, they specifically express the cytokeratin. So if the cytokeratin markers are usually expressed, we know that these are carcinoma cells. Similarly, if there is expressing the desmin and myogenin, this kind of markers, we know that they are sarcomas because they are originating from the solid mesenchymal tissue. If a cancer cell is expressing CD20, you would be thinking that they are actually of B cell lymphocytic origin, so it's a B cell lymphoma. If they are origin lymphoma, if they are expressing a CD3 marker, we know that they are basically a T cell origin lymphoma. So in this way, actually, the immunohistochemical markers, they are helping us to pinpoint a diagnosis. That's the basic idea of this. And please don't confuse IHC, immunohistochemical marker, with tumor marker. Tumor markers are basically tumor associated some hormones, some proteins which are detected in the serum or could be detected in the stool, but they're not, we are not doing it actually on the tissue sample, on the biopsy sample. They're quite different. So many times if you ask that what is tumor marker, we sometimes confuse with IHC marker. IHC markers are different from immunohistochemistry, is a different principle than tumor marker. Tumor markers are also used for cancer diagnosis, but it's a different thing. Now, another thing I often tell actually when I teach, that cancer is nothing but or pathology is nothing but actually the to diagnose, to differentiate between apple and orange. That means if you have two cancers and you are confused between two cancers, it could be carcinoma and sarcoma, and you need to be very sure, then that is from apple and orange, you can, this immunohistochemistry can help actually to specifically diagnose that. Second thing, other than exact categorization of the cancer, the second thing where immunohistochemistry comes to play a major role is to tell you the primary site of a metastatic cancer or metastatic tumor. Suppose you have a bone lesion, bony lesion, and it's a cancerous lesion, and you see that these cancerous lesions are expressing on tissue prostate specific antigen on tissue section. I'm not talking about the on the serum PSA level. So then you know that these bony lesion is probably metastasizes from the prostate. It's a metastatic prostatic adenocarcinoma in the bone. In this way you get the idea. Similarly, if you get a lesion in the bone and which are expressing the markers for the metastatic renal cell carcinoma, you know that this cancer is not originating from the bone, they are coming from the kidney, which is renal cell carcinoma. So in this way, in a metastatic lesion, the exact primary site could be detected with the help of immunohistochemistry. And third place where immunohistochemistry plays a major role is in prognostication and also to dictate the management of therapy. Particularly, it is very useful in the case of breast cancer. In the breast cancer, we usually go for triple markers, ER, PR, and the HER2. So if the breast cancer cells are positive for the estrogen receptor, then you can use this particular type of drug, tamoxifen in that case actually. If they're positive for HER2, they can usually use for Herceptin or trastuzumab. And also if they're positive for ER, actually they carries a good prognosis. So in this way, the immunohistochemistry which you are doing additionally on a tissue biopsy, it can help you to tell the prognosis of a patient, particular cancer patient, or also can help you to formulate your management principles in that exact type of subtype of the cancer case. So because all cancer cases are not same, all breast cancers are not same. Some breast cancer carcinoma cases could be ER positive, PR positive, but HER2 negative. Some could be HER2 positive, but others negative. Some could be triple negative. So all these have different outcomes and different way to manage them. There are subtle variations are there. So these cases, these things, the newer advance or the newer arrivals of these various kind of techniques, particularly the immunohistochemistry techniques, would helps us a lot in various aspects. So in a nutshell, what you need to know, that it's a immunohistochemistry is a powerful adjunct tool, add-on on the usual biopsy methods we do to specifically, precisely pinpoint the exact subcategorization of a cancer. Second thing, it helps, that usually helps us to tell us the primary site of a cancer in a metastatic tumor site. That means if in a certain organ is carrying a metastatic tumor, you know exactly from where they came from. And third thing, it also helps us to prognosticate a cancer by detecting specific tumor markers, and it also helps us to exactly formulate the management of that specific cancer. And usually it uses the immunological principles, antigen antibody reactions, to particularly detect a specific antigen or a protein, usually on the cancer cells over its surface or inside the cancer cell, which is specifically expressed by that type of cancer only. So this is in a nutshell the basic principle of the immunohistochemistry. The other principles I'll be discussing, like flow cytometry, in the other Insta lectures. Thank you very much.